Hey everyone, and welcome to today's explainer. We are jumping straight into a topic that is just absolutely crucial for both mom and baby, pregnancy medications. Look, we're basing this on the fantastic guidance from Dr. Anjali Kumar. And let's be real, when you're expecting, your body is going through so many changes, and trying to figure out what's safe and what's dangerous, it can get incredibly overwhelming. You want to do everything right, obviously, but there's just so much conflicting info out there. Well, we're going to clear all that up today. We're unpacking exactly what is safe and what is surprisingly dangerous, hiding right there in your everyday medicine cabinet. Because, it happens to all of us, right? You wake up at 2 in the morning, your head is throbbing, you're super stuffy, or maybe your lower back is just aching after a really long day. And your first instinct, because it's a habit you've had for years, is to just wander into the bathroom, open that cabinet, and grab whatever's handy to get some quick relief. It's totally natural. You just want to feel better. But the moment you're pregnant, that innocent, automatic habit, it suddenly becomes a really high-stakes decision. You actually have to stop and take a complete pause. Okay, let's dive into this with a pretty stark reality check. Dr. Anjali Kumar puts it incredibly plainly. She says, all medicines taken during pregnancy can go to the baby. It really is that simple and honestly that profound. Because remember, you are literally sharing your bloodstream. The placenta is an amazing organ for sure, but it is not this impenetrable magic shield. An innocent choice you make to just relieve a minor ache can actually have serious unintended consequences for your developing baby. Their tiny systems just cannot process medications the way your fully grown adult body does. So here's our roadmap for this explainer. We're going to cover the hidden medicine cabinet dangers, then we'll tackle everyday aches, colds, and skin stuff, moving on to fighting bacterial infections safely, managing chronic conditions, and finally, we'll wrap up with the golden rules for pregnancy. All right, let's kick things off with part 1, the hidden medicine cabinet dangers. To really protect your baby, we kind of have to understand how health authorities actually classify these medications. Let's look at FDA Pregnancy Category X. Now, this classification is literally as serious as it gets. It means clinical studies have definitively shown that the drug harms the fetus, and the risks completely, without a doubt, outweigh any possible benefits. Want a perfect example of this just hiding in plain sight? Those innocent-looking anti-acne creams and retinoids like isotretinoin? I mean, we all want glowing skin, right? You might buy a fancy anti-aging serum online or just grab a quick acne spot treatment at the store and be completely unaware that it contains highly potent, lab-made forms of vitamin A. And here's the kicker. Even when you just apply it topically to your face, it gets absorbed right into your bloodstream. If you use these during pregnancy, these compounds can actually cause the baby's brain, nerves, or heart to develop abnormally. It massively raises the risk of miscarriage and premature birth. It's a huge hidden trap. Moving right along to section 2, everyday aches, colds, and skin. Let's talk about the super common stuff. Okay, so when a headache or a backache strikes, you really need to know exactly what to grab and what to leave on the shelf. You absolutely must steer clear of NSAIDs. These are your non-steroidal anti-inflammatory drugs, things like ibuprofen, or even those topical pain-relieving gels like Volini. It is so easy to just pop an ibuprofen for a headache, I know. But in 2020, the FDA actually issued a stark warning against taking NSAIDs starting around 20 weeks of pregnancy. Why? Because they are directly linked to life-threatening kidney problems and serious heart issues in the developing fetus. And yes, even just rubbing a seemingly harmless muscle gel on your aching back carries significant risks, because those active ingredients get absorbed right through your skin. And this brilliantly illustrates our safer option. Instead, you want to reach for paracetamol. You probably already have it in your cabinet under brand names like Tylenol, Dolo, or Calpol. It is a simple swap, but a profoundly important one. Now, what about when you are just totally congested? Pregnancy can actually cause a stuffy nose all on its own, and if you catch a cold on top of that, man, you feel miserable. It's incredibly tempting to just grab that intense nasal spray your partner left in the cabinet. But you've got to pause. Nasal decongestants with active ingredients like pseudoephedrine, or those really popular quick fix drops like Otrivin, they generally need to be avoided. They fall under Category C, meaning the medical community advises against taking them, especially during that crucial first trimester, because they're actually linked to a higher risk of birth defects. So what's Dr. Kumar's safe alternative? Good old saline nasal drops. Yeah, they might take a little bit longer to work, but they are entirely safe. And if you're dealing with allergies, safe anti-allergy drugs like levocetirizine are a great option. Even certain steroid nasal sprays can work. But, and this is a big but, only if they are explicitly approved by your doctor. All right, that brings us to Section 3, fighting bacterial infections safely. Listen, here is a golden rule for pregnancy. Never, ever self-prescribe old antibiotics. Look, we're probably all guilty of this at some point. You find a few pills left over from an old prescription, you start feeling that familiar tickle in your throat, and you think, I'll just take these to knock it out. Well, take a class of antibiotics called fluoroquinolones. Ciprofloxacin is a super common example. People hold on to these in the back of their cabinets all the time. But in pregnancy, these are Category C medications, and that categorization is based directly on birth defects observed in animal studies. So the crucial point is, popping an old pill just to quickly knock out a suspected infection, it is simply not a risk worth taking for your baby. You always need a fresh diagnosis and a prescription that is specifically safe for pregnancy. And honestly, the risks get even more severe with other classes of antibiotics, like tetracyclines. Think doxycycline. This one is a Category D medication, which means there is actual positive evidence of human fetal risk. The side effects here are genuinely shocking and really show just how powerful these drugs are. Not only can doxycycline cause severe, dangerous liver damage in the expectant mother, but it actively crosses the placenta and can fundamentally alter the baby's bone growth. Even wilder, taking it during certain stages of pregnancy can literally result in the baby having permanently yellow-colored teeth as they grow up. No way, right? But it's true. This perfectly highlights why extreme caution and strict doctor supervision are absolutely required before taking any antibiotic. Let's transition into Section 4, managing chronic conditions. Now, avoiding unsafe medication absolutely does not mean stopping essential care for pre-existing conditions. Your health is literally the foundation of your baby's health. It just means we have to actively pivot your care plan. Now, what's really interesting about this slide is how clearly it maps things out. For instance, if you manage high blood pressure, you obviously can't just stop for meds, but you must avoid ACE inhibitors and ARBs. They can severely harm the baby's developing kidneys and dangerously lower your amniotic fluid levels. Your doctor will just swap it for a pregnancy-approved alternative. Prone to blood clots? Warfarin is a known Category D risk that crosses the placenta, so the standard safer swap here is typically aspirin or heparin injections. And for managing diabetes, while a lot of traditional oral meds need to go, metformin and insulin injections are considered safe and highly effective. Keeping blood sugars strictly controlled, especially during those critical organ-forming weeks of the first trimester, is just absolutely vital.
And hey, this proactive management absolutely applies to mental health as well. Managing anxiety is crucial, but how you do it matters immensely. Let's talk about benzodiazepines, commonly called benzos. This includes widely recognized names like Alprazox, Valium, and clonazepam. Unfortunately, these anti-anxiety meds are commonly abused or sometimes even bought over the counter without proper oversight in some places. During pregnancy, they jump straight to a severe Category D or even Category X risk. They are directly linked to devastating developmental issues in the baby's brain, esophagus, and heart. Plus, they drastically increase the risk of miscarriage, contribute to lower birth weights, and can even lead to incredibly painful, distressing withdrawal symptoms for the newborn right after delivery.
Similarly, if you are managing bipolar disorder with a medication like lithium, extreme caution is required here. Lithium is a Category D medication that is especially dangerous during the very first trimester. Because think about it, this is the exact window when the baby's heart is actively forming. Lithium exposure can cause serious, permanent fetal heart defects. So Dr. Kumar's advice here is absolute and completely non-negotiable. If you are on lithium and you want to start a family, you must get coordinated, explicit approval from both your psychiatrist and your gynecologist before you even attempt to conceive. Your entire care team needs to be 100% on the same page. All right, let's move to Section 5 and see how this builds into our golden rules for pregnancy. We have talked a lot about the don'ts, right? But here are the empowering, proactive do's to ensure the safest possible environment for your baby. Step 1. Optimize your health before you even plan the pregnancy. Seriously, preconception planning, getting your chronic conditions managed safely, and starting those prenatal vitamins makes all the difference in the world. Step 2. Never, ever self-medicate with over-the-counter drugs. Doesn't matter if it's just a cough drop or a muscle rub. When in doubt, trust your doctor and only your doctor. And Step 3. Educate yourself. Yes, your doctor is your main guide, but official resources from the CDC and the FDA offer this incredible wealth of accessible, science-backed info to help you understand exactly what you're putting into your body. So as we wrap up this explainer, I want to leave you with a direct challenge. Is it time to audit your own medicine cabinet before your baby arrives? Armed with this clear, focused knowledge from Dr. Kumar, you now have the power to take confident, decisive action today. Go into that bathroom, throw out those old expired antibiotics, set aside those unsafe skin creams, and step into your pregnancy feeling empowered, educated, and completely ready. Because your baby's health, it starts with your everyday choices. Thank you so much for joining me today, and keep learning.